Let's talk about chronic inflammation. Hello, this is Dr. Siddharth Ambar from Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. Today, I'm going to talk about something that might be affecting you right now, inflammation, and how to stop it before it causes damage to your body. Inflammation is your body's normal way of protecting you, but sometimes it can get out of control, leading to pain, swelling, and even long-term health problems. When your body senses an injury or an infection, it responds by increasing blood flow to the area, which causes redness and swelling. This is your body's defense system at work. Acute inflammation is normal and helps your body heal. But when it sticks around too long, chronic inflammation begins to damage healthy tissues and organs. So what causes chronic inflammation? Poor diet, lack of exercise, long-term stress, and even toxins in the environment can keep your body in a constant state of low-level inflammation. For example, eating foods high in sugar and processed ingredients can trigger your body to stay inflamed, which over time can lead to conditions like heart disease, arthritis, and even cancer. What are common signs of chronic inflammation? You may notice fatigue, joint pain, digestive issues, or even weight gain. These are all signs that your body might be dealing with inflammation. A real-life example, I've had patients who come in with lingering joint pain that won't go away. And more often than not, chronic inflammation is a contributing factor to their discomfort. So how do you stop inflammation before it harms your body? One of the simplest and most effective ways to control inflammation is through your diet. Anti-inflammatory foods are important. Foods rich in omega-3 fatty acids, like salmon, flax seeds, and walnuts, are known for their anti-inflammatory effects. Leafy green vegetables, like spinach and kale, berries like fruits and nuts, like almonds, are also great choices to help lower inflammation. Supplements can also help. Omega-3 fatty acids, turmeric, which contains the anti-inflammatory compound curcumin, and vitamin D have been shown to reduce inflammation in many people. I recommend these to my patients, especially if they're dealing with conditions like osteoarthritis or joint pain. Alternatively, some foods can trigger or even worsen inflammation. These include highly processed foods, high in sugar, trans fats, and refined carbohydrates, like white bread and pastries. Red meat and fried foods can also increase inflammation as they contain compounds that lead to oxidative stress and a greater inflammatory response in the body. Sometimes inflammation is more than just your body's reaction to stress or injury. If you have an autoimmune condition like rheumatoid arthritis or lupus, your immune system is attacking healthy tissue, causing long-term inflammation that can lead to damage in your joints, muscles, and other organs. In these cases, it's possible you'll need a disease-modifying medication to control the inflammation and prevent further damage. These medications can slow down the progression of disease and help prevent irreversible harm. While disease-modifying drugs are important in autoimmune conditions, regenerative medicine can be incredibly helpful in conditions like osteoarthritis and tendinitis. By focusing on improving tissue integrity and joint stability, regenerative medicine treatments like prolotherapy, platelet-rich plasma, and bone marrow concentrate stem cells can progressively reduce inflammation by targeting the underlying weakness in the joint. When tissues are healthier and stronger, there's less need for your body to send an inflammatory response. If left untreated, chronic inflammation can lead to irreversible damage in your joints, muscles, and organs. This is why it's so important to take action early. The earlier you address it, the better your chances are of preventing long-term damage. So if you're experiencing any signs of chronic inflammation, don't wait. Talk to a doctor who can help you get to the root of the problem. You can learn more about how we treat inflammation at Chicago Arthritis by visiting our website or calling our office. Thank you for watching. If you found this helpful, give us a like and subscribe. Until we connect again, have a good day and live well. Bye-bye.